Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lily Shockney.
Hi, this is Lily Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Healthy Insights That Matter. Today, I am talking with two Johns Hopkins medicine experts about changes that occur over a woman's lifetime, particularly related to intimacy levels. Dr. Kate Thomas is a psychologist who serves as the Director of Clinical Services for the Johns Hopkins Sex and Gender Clinic. And my second guest is Tammy Sen, a doctor of nursing in the Johns Hopkins Gynecology, Sex and Intimacy Clinic. So welcome to both of you, Dr. Thomas and Dr. Sen.
Nice to be here. Thank you.
Thank you, Lily.
So I want to start off with talking about teenagers as well as women under the age of 30. This age range must be full of psychological and physiological changes for women, and the three of us are women, and I certainly remember going through some changes I liked and some that I did not like. But can you fill us in on what's happening with a female's body as she's going through her teenage years and then entering her young adult years?
Sure. One of the things I wanted to start out by saying as we get into these developmental years, and I'll come right back to teenagers, I promise, was that what we know about human sexuality, essentially from birth till death, people really vary. So we're going to talk about how things can change at various stages. But when you think about it, some people are just more sexual than others. And we don't completely understand that. We just know it's true. Even as little kids, we can have young kids who are very fascinated by sex and other kids who aren't. So just to be aware, there's a lot of variant here. We all know that with teenagers, I'll turn this back over to Tammy in a second, but we know there's puberty that happens and what happens there. But from more of a sociological and maybe psychological sort of point of view, we know boys are often more driven because of high levels of testosterone to be more sexually focused, whereas girls, they're sexually focused too, but a lot of it relates to relationship or that kind of thing. But being teenagers, there's an enormous amount of curiosity. So curiosity is also a driver of sexuality. It's kind of threefold. It's the changing hormones. It's for girls a lot wanting to be in a relationship, wanting to be cared about or someone attracted to you. And then thirdly, this curiosity component. So I think those are three things I'd put in there to get started. Yeah, Tammy.
Thanks, Kate. I completely agree with you that we really need to normalize the variety in sexuality, especially in the years of puberty. Not only psychologically, but physically, people will develop very differently. I completely agree with you that the amount of sexual interest, curiosity, and even sexual desire at young ages can vary a lot based on a lot of different things. I think culturally, we don't do enough to encourage conversation around this. And I think that's very important for anyone who may be parenting someone going through this time period, or maybe someone who's listening who is in adolescent years and has a lot of questions or a lot of curiosity. I think it's important that we're open to conversation about this. And that's not something historically that has been welcomed in our culture. I think the other thing that's important to keep in mind for teenagers is that we have these very concrete ideas about what is normal. And I think especially for generations coming up now, they have a lot more permission to explore their sexualities in ways that maybe older generations weren't permitted to. And I think it's really important that we try to understand this capacity for different sexualities.
Are you finding that for teenagers, things have kind of gotten jump-started even earlier than being a teen? I work and take care of breast cancer patients, and when I'm getting their medical history, one of the things that increases risk of breast cancer is beginning menses under the age of 12. And I'm seeing, oh yeah, I started at 10, I started at 11, or my daughter just started at 10. Does that have an impact on this as well, that we're jump-starting things earlier in their lives?
We have to keep in mind that if you are menstruating, then your what we call the HPA axis has begun to mature. And this is just a fancy way of saying that you're under hormonal influences now. And once you're menstruating, you are in your fertile years. And if we think about that in terms of fertility, that's the purpose of menstruation. Mother Nature's point there is to procreate. So of course, we're going to have an earlier interest if we have earlier menses. That does play a role. And that doesn't make this right or wrong. It's just the rate at which we mature.
What changes do women experience regarding their sexuality before perimenopause or menopause?
Big period of time there, but it probably makes sense to a certain extent. Women are interesting because what we find is the incidence of orgasm, ability to be orgasmic, is somewhat older than men. I mean, there are 4-year-old girls who masturbate to orgasm, and 4-year-old boys for that matter, but there are many young girls, teenagers, young adults who cannot orgasm reliably. What we see in about 25 to 35-year-old age range, we're seeing that seems to be the peak of women learning, whether it's because they're learning, perhaps, or think about changes in their body. I don't think we know, but there does seem to be an increase in that period of time. So women are coming into their own. We think of hormones as being sort of stabilized in that period of time. I mean, stabilized and then, of course, cyclical every month, but stabilized over time between menarche and menopause or perimenopause. But nonetheless, there are great changes in those age ranges. Now, a lot of it depends on relationship with women. So it's not all about hormones. And again, I'll turn back to Tammy for some of this. But if you're having short-term relationships, more often than not, your sexual desire or sexual interest is pretty high. You get into a long-term relationship, and even in the best of relationships, that drive diminishes. And people worry about it. They think there's something wrong with them, but it tends to just be the norm. Perhaps familiarity breeds it. It's a very kind of interesting thing that happens. And so we don't do a lot with women, even in our therapy, to try to help them develop more desire, from almost like a physiology, because we don't even know how to do that in that period of time. So we're looking more at helping them enjoy sex more, find ways to be aroused, find other reasons to be sexual. We know women have sex for non-sexual reasons most of the time, particularly in long-term relationships. So we can't separate that kind of thing out. Now, plenty of women are also demonstrating sexual drive and sexual interest in those years by masturbation. But again, interesting things happen. I mean, there's some sociocultural overlay that says masturbation's for people that aren't in a relationship. Once you're in a relationship, your sexual outlet should only be partnered sex. There's lots of things that can play in there.
I saw several years ago a presentation. The part of the presentation that I remember the most is this wooden board that was on one of the slides. It had knobs and drawer pulls and buttons and all these, the whole board was full of these kinds of hardware. The speaker said, "This is what's going on in the mind of the woman when she's having sex." And then he flipped to the next slide and it says, "This is what's going on in the man's head when he's having," it was just one button, right? One button that said orgasm. Of course, the entire audience laughed, and I thought, oh my gosh, this is so true, right? This is really true. Women's lives become so daggone busy. They're working, they're a mom, they're a wife. They probably are also having to take care of their parents. I mean, there ought to be like 2 buttons for parents or something. Intimacy kind of becomes an afterthought rather than a forethought, but it stays as a forethought, I believe, certainly for men. This year, I will be a 33-year breast cancer survivor. I've been diagnosed twice in my 30s, then again at the age of 40. And I was placed on hormonal therapy, anti-estrogen therapy. It's usually the way women understand it better. And so everything shut off, right? It was just like flipping a switch. When I took that pill every day, just the last thing I wanted to think about was intimacy. My husband, said, "Tell me what's wrong." And I said, "It's this pill that's wrong." And he said, "Do you have to take it?" And I said, I do, because it's going to reduce my risk of getting breast cancer again by 47%. But I hate this pill. And I put patients on this pill. It drives me crazy. He took a Post-it and wrote 47% and stuck it on the bathroom mirror so that every morning I would see why it's a good idea to take this pill. Now, what I didn't do and should have done, I mean, next month we'll be married 47 years. I didn't ask him, what are you doing? I don't know if I didn't want to know or what. But once I came off of the 5 years of this drug and everything jump started back again and was good, I said, what were you doing during this 5-year hiatus? And he said, I became an owner operator in the shower. Oh, my gracious. I really should have asked you about this and probably been more helpful as well. But that's what he told me was going on. I thought, oh, my gracious. We do have so many breast cancer patients because estrogen is a feeder of breast cancer cells, unfortunately, who do flip into menopause. In some cases, that's going to be forever, even though they may be young. We might even take their ovaries and fallopian tubes out because of the stage of their disease being high and such. And they don't quite know what to do. They'll say, my body has aged 25 years in all respects. That is certainly very, very true. When we think about sex, I don't bring up sex. I bring up intimacy, and that there are certainly ways to be intimate without it resulting in actual sexual activity. And that I think when all is said and done, the relationship can be enhanced as a result because they haven't really been intimate before. They've been physically sexually active, but they haven't been intimate. It's an opportunity for revisiting their relationship and why do they fall in love and what other hurdles in their life have they been through, etc. I am a believer in that discussion of intimacy versus sexual activity. So women experience perimenopause at different ages. I've certainly been seeing perimenopause seemingly happening like maybe around the age of 50. And you both advise us if that's like the average age that you see. What symptoms around intercourse suggest that a woman is entering perimenopause, and how can that affect her intimacy and desire levels?
I get a lot of women in the perimenopause timeframe who come in and say, I lost my libido. I don't know where it went. Maybe it's in the closet somewhere. Maybe I dropped it out of the car when I was shopping. I don't know, but it's gone. And it was sort of an overnight thing. And that's not an uncommon experience. But at the same time, there are a lot of women who enter the perimenopausal stage and don't notice a change in their sexuality. There are a lot of women who say that they have an increase in feeling sexual because, maybe they've had really painful, heavy periods and now they're free from that. Both of you touched on some really important points that we sort of put sexuality in a box. I think it's really important that we keep in mind that your overall health affects your sexual functioning. So it's not just one thing. I always joke with the women that I talk to that women come into my exam room all the time and say, I have the sexual problem and I have no idea why it's happening. And then they proceed to tell me exactly why it's happening. So they actually do know if your diabetes is uncontrolled, if your hypertension is uncontrolled. All of these things are going to impact your sexuality, just like your cancer diagnosis. And so when you take medications and you think it's affecting your sexual response, really the big thing that I want people to take away from this, regardless of what your sex life looks like, regardless of how you define your sexuality, is I hope you won't be afraid to take it to your healthcare provider and say, can we talk about this side effect? Is this affecting my sex life? Is my health condition possibly affecting my sexual response? Is this medication you've prescribed for me? And can we talk about options? Because sexuality is a part of our quality of life, and that's really, really important. And as you say, it's also important for us to recognize that not everybody's sexuality looks the same. And the key to our sexual repertoire is the intimacy part. And I wanted to kind of take a second and back up for some of our listeners who might be reeling from Kate's first comments, because she just kind of dove right in there with words that are a little taboo and sometimes take people aback. But just recognize you do have healthcare providers out there who are open to these conversations. And so I hope that people won't be afraid to bring this up and they won't feel the way that you felt about how this changed your life.
I think that it can be more complicated if the doctor that they are seeing, whether it be their PCP, their GYN, or their oncologist, if that individual is a man. It's like, don't they want to talk about that with him? And unfortunately, he doesn't want to talk about it either. How are you doing on your medication? Fine. They don't want to go there. And we need to serve as that bridge. Sometimes we need to serve as the substitute. People have teased me for years that I am the Dr. Ruth in the breast center, because I've always felt comfortable discussing these kinds of things. How about body image? And of course, I live and breathe in that space. Women having mastectomies with and without reconstruction, weight gain during taking hormonal therapy for 5, and now it can go all the way up to 10 years. Chemotherapy, people think they're going to lose weight. They usually gain weight. So there's this, I don't like who I'm seeing in the mirror anymore. And if I don't like what I'm seeing, then certainly my partner isn't liking what he or she is seeing, which isn't necessarily true. But it's that silence, right? They're not going to talk about it. And I think that's really very unfortunate, whether it be a relatively new relationship, and we certainly do have people in these medical crises with being diagnosed with cancer that are 30 years old versus in their 50s or 60s or 70s. There isn't an outlet per se. If they Google sex, they're going to, oh, golly day, boy, oh boy. And then their email is going to start filling up with whips are on sale until Friday, or we have a special 2-for-1 on handcuffs. I mean, there's just, once you type in that on a search engine, it's like you get attacked with things that was not your intention at all, and try to get off of those mailing lists. Ay, not very easy. What do you advise to women who are saying, I want to be the way I was, and I'm not sure that can happen? And do you talk to them about body image? How do they see themselves? How do they think others see them?
I was just thinking about how complicated, when we talk about things like sexual drive, libido, interest in sex, it's so complicated because we don't even understand with women where it all comes from. I mean, can we boil it down to hormones? Well, no, it doesn't work that way. What are we looking at? So you're taking a woman in this period of time who, I think you alluded to it, Lily, that people get busy, work, stress, kids, blah, blah, blah. So another thing is how they feel about themselves. There's some interesting data on women's sexuality, kind of specific to women, not men, that women are more turned on to how attractive they are, they see themselves as, than their partner. It's this perfect kind of thing. It could be a perfect thing where men oogle women, if they're heterosexual. They oogle the woman, right? They like to look at, and see a naked woman. Women tend not to so much like to care about looking at their partners naked. What they want is to be the object of desire. So if they don't feel that they're the object of desire, they don't feel sexual. And so this body image thing can fit in there. And frankly, body image can be anywhere. I remember my daughter-in-law, when she was younger, she was like 20, lovely girl, lovely. Like I'm thinking, at my age, she looked great, but she didn't like her knees. I don't mean that facetiously, but, she just didn't like the way her legs looked or her knees. We would talk about this body image thing. To me, she looked lovely, right? But probably to you all, because she was young and sweet. So body image can go all over the place. It's not just based on getting older and some women age and feel fine about their bodies. One of the things we work with people on is, I always teach people that sex is a meditation. Good sex is a meditation, because we're in a meditative state where we're not like so distracted by all of these other things. We can just be in the moment, in the situation, feeling the sensations in our bodies, or maybe having an erotic fantasy. there's lots of ways in which we can teach people or help people to become more focused away from their bodies. This idea that we can work with body image. And again, like I said, it can be for anyone, young women, older women, heavy women, thin women, women who've had alterations to their bodies of various types. I really think that we, have some capacity to do that. But it is a big factor in why, women don't want to be sexual. And sometimes they're even embarrassed to tell anyone that that's the reason why. And so it can take a while to get that information out from them.
And I think, too, body image of their partner can certainly influence them as well, right? That he or she doesn't look the way they looked 30 years ago. And does that feel okay for her, or does that not? I think sometimes, I remember I said to a patient when she was talking about her husband, she said, I'm okay. I'm back to having my sex drive again. She said, but, my husband has gained 40 pounds. It's like trying to tackle an obstacle course now. And I said, well, you got to get creative. It may not mean that you're going to do things and the positions that you did before exactly the way you did before. You might be flipping things around and such. And she said, well, we've never done that. And I said, does that mean you can't? You won't? What does that mean? And she said, no, it's just that we've never done. I said, well, it sounds like a new opportunity. Sounds like a brand new opportunity. When I saw her the next time, she said, we're exercising our opportunities. I said, that's good. I'm glad to hear that very much. When we're looking at perimenopause and menopause with vaginal dryness and not having the urge, shall we say, what do you recommend? Because we certainly don't want women in pain, and we don't want them to express to their partner, I don't want you anymore, when the issue is I'm in pain when we do this or that. So what remedies are there? And what advice do both of you give when that is the situation for a patient?
I think, again, the important thing is to talk to your healthcare providers. I spend a lot of time in visits talking about vaginal estrogen, which for some reason still has a lot of stigma. Women are still a little bit hesitant to embrace this, but it makes such a difference for the tissues of the vagina and for vaginal health to decrease pain, just relieve so many discomforts that many women complain about in this period of life. If you are one of the rare people that your healthcare provider recommends you don't use topical estrogen, just to be clear, we found that it's safe for the vast majority of women, even most cancer survivors.
Right.
Then there are still vaginal moisturizers that are available over the counter. I'm a huge fan of products that contain hyaluronic acid. There are good studies that show that mirrors the efficacy, the effectiveness of vaginal estrogen. So that can go a long way. And that's something that you can purchase and trial yourself. I spend a lot of time talking about vaginal lubricants. There are different kinds, and I talk with women a lot, but I find for menopausal women that silicone-based lubricants are going to give you probably the most satisfying results. Water-based lubricants usually don't work well with menopausal tissues. But also important to keep in mind that not everybody has intercourse as the center of their sexual repertoire. A lot of the things that you talked about, Lily, sex changes as we go through different life stages. Sex is very different for adolescents than it is for postpartum women, than it is for perimenopausal women, than it is for menopausal women. Keeping in mind that we have a great capacity to learn new things in our sexuality. As you talked about, there's something called erotic plasticity, which is just a fancy way of saying what you find sexually attractive can change. So we do have that capacity, and you may think your partner doesn't find you attractive, but they have the capacity to find new things attractive. There are lots of things on the market. You joked about handcuffs and all the mailing lists you might be on, but there are great products out there that you can use as sexual enhancers. If you have arthritis, there are lots of pillows and props that you can use to help you position yourself for sexual activity. Lots of things that can help blood flow to keep your vaginal health. And these are conversations that I'd love for us to start having. I want people to be happy and comfortable in their sexuality as they go through these life changes.
You brought up a really good point about vaginal estrogen and is it safe? Originally, this goes back more than 20 years ago now, it was determined through clinical research studies that hormone replacement therapy in the form of a pill, that's where the bugaboo was that people weren't saying we're talking about taking it orally and how high the dose is, that ended up being listed as a carcinogenic agent for breast cancer. But nobody ever said, oh, we forgot to talk about vaginal estrogen. And that vaginal estrogen is such a minuscule dose and very low absorption into the bloodstream, and it's okay to use it. That, for whatever reason, didn't get discussed. There are also women that may be using a patch. I actually don't know what the dosage is of that, but if they are concerned that this might, stir up some form of cancer recurring or starting, it's really important to be talking back again, as you said, with their doctors. And if their doctors don't have this knowledge, and they might not, unfortunately, then it's a good idea to go to a specialist who does understand this, and to go to you too, because you understand this. I had a woman in her mid-50s who had stage 3C breast cancer, very advanced breast cancer, single, never married, no children, needed a mastectomy, and we were not able to do reconstruction because of the extent of her disease in the skin, in the flaps. So in any case, when I'm talking to my patient, I'm saying, tell me, are you in a relationship currently? And no, she said, the last time I was in a relationship was when I was in college. And so I'm thinking back. That's more than 30 years ago. She said his name is Michael, and I loved him, and we were engaged. And in the senior year, he came to me. He says, I fell in love with somebody else. And she said, and that did it for me. She says, so I've never dated after Michael. I've never had any interest in even thinking about dating anybody other than Michael. And now my situation, I definitely would never pursue dating anybody in my condition. So the following visit that I had with her, she said, something's happened. And I said, is it good or bad? And she said, I don't know. I need help with this. I said, okay, tell me what you got. She said, Michael has contacted me. Now, we haven't seen each other for over 30 years. He has moved back to Baltimore. He is divorced. He has 2 children. He wanted to know if I was single or not. And I said, yes, I haven't been with anybody since I was with you, which stunned him. And he said he wants to take me to dinner. And I said, well, what do you want to do? And she said, I'd like to go to dinner. I said, then go to dinner. Well, should I tell him what's going on? That I'm in the, this is a wig that looks like my hair. Or I said, not necessarily on that first date. Just have a light conversation and not a heavy conversation. Okay. Now they started dating regularly. She was calling me to tell me this day went really well. We went to the movies. We laughed. I felt like I was in my 20s again. I'm like, wow, I don't feel like that. Then she called me. This was like 6 months into this. And she said, he wants to take me to Ocean City for the weekend. And I said, do we have 2 rooms or 1 room? And he said, I think 1 room. Do we have 2 beds or 1 bed? And he said, I think we have a king size bed together. And she said, I don't know what to do. Well, he's telling you he wants to be intimate with you. Right now, you've just been kissing, right? Yes. I said, okay. Do you think you're ready for this? And she said, I don't know. She said, everything is so dry everywhere. Like I said, I haven't been with anybody since I was with Michael in my 20s. So I said, I want you to go to, your local pharmacy, and I want you to get some Astroglide. So she wrote that down. That is my recommendation as to what to use if part of what's going to be happening is intercourse. And she said, okay. And she said, I think I'm going to buy a really pretty nightie. Oh, that sounds like a good idea. Should I keep my bra on because it has a breast prosthesis in it? I said, does he know you have breast cancer? Yes. She says, I have told him that, and I've told him that I'm a pediddle, that I have 1 breast and the other one's gone, but I wear a breast prosthesis. I said, well, you made a lot of progress there. And she said, yeah, I think so. And I said, just think back about how much you adored and loved him, and that he just kind of made a mistake. He said, oh, he told me he made a huge mistake in not having us stay together. I said, I think you're ready. Go ahead and go. Well, Friday night, 3 a.m., my phone rings. Usually that means I got a family member in the ER somewhere. So my husband passes me the phone, and it wasn't a family member. It was this patient who said, I'm in the bathroom. We're in Ocean City. I've got on my nightie. I don't know if I should take off my bra and put my nightie back on. I bought 5 bottles of Astroglide. And I'm, wow. The pharmacy thinks that you were providing Astroglide for everybody who's spending the weekend in Ocean City. Believe you me, a little dab will do you. You're not supposed to pour this in yourself. Where do you feel like going with this? Do you feel like taking your bra off? She said, I think I do. I said, okay. She said, but he's got the lights on out there. And I said, okay, you can tell him to dim the lights or tell him you're not sure if you want the lights on. And so she made a decision that he had 2 lights on. She said, I told him to turn 1 light off. Okay. I hung up with her, and an hour and a half later, she calls me back. My husband just handed me the phone. And I said, are you okay? And she went, yeah. These 2 people got married. Long time between love and re-love again. And he took care of her. And she died 4 years later in the arms of the man that she always loved. I just thought this is a true love story. I thought it was wonderful. But this story with this particular patient was over 25 years ago. I'm sure that since that time, there has been other products probably developed that might be a better option than the Astroglide, or that we may have more clinical information about. Back then, that was the only thing sitting on that shelf. Can you educate our audience as well as me about what would you recommend for patients today?
Lily, that is such a great question. And that's something that I spend a lot of time discussing with my clients who want to talk about vaginal lubricants. We talked a little bit before. There are 2 types. There are water-based lubricants and there are silicone-based lubricants. I think KY was probably the first product marketed, and I think that goes back, I don't know, correct me, Kate, if you know, 1906 or something like that.
Yeah.
And these products are not overly tested. We know so much more about vaginal tissues and the vaginal microbiome, which for people who aren't familiar, the microbiome is a part of our body that we know we inherently have bacteria and organisms that work in our body to keep us healthy. And a healthy vagina has its own microbiome. And what we've learned is that a lot of water-based products actually have the potential to damage that microbiome, especially in menopausal women, and can further break down the vaginal tissues. I'm not saying all products are bad. We've got a lot better choices now. As far as water-based products, I'm actually a fan of a lot of the products made by Good Clean Love because they do develop products with an eye for vaginal health. Another product, if you're looking for a good silicone lubricant, I recommend Uberlube to a lot of my clients because it doesn't have a lot of unnecessary additives that can be irritating to the tissues.
Can you spell that for the audience?
Oh, Uberlube. It's like the auto
like
service.
The Uber? Like driving?
Yeah, like the Uber.
Being driven somewhere?
Yeah.
Oh, that's funny. Wow, calling an Uber driver a new meaning there. Wow.
I don't know, Kate, do you have any favorites or any different things that you recommend?
Those are some good ones. There are a number of products now in the market that you kind of have to do research on them because they really are designed to address those issues, as you're saying, Tammy. Interestingly, one of the things that I still see out there is people coming to me using petroleum-based products like Vaseline.
Oh.
You know, to be very, so just word of warning, this is not a good product to use. The other thing that we recommend a lot is to use, you can't do it if you're using condoms, so you have to be careful of that, but to use vegetable oils. So we use coconut oil is often recommended both as a treatment as well as a lubricant itself. That's something that we talk about a lot.
I think that will surprise many of our listeners. They wouldn't have thought necessarily about going into their kitchen.
Right. I mean, theoretically, you could use olive oil. People like coconut oil best, and it's inexpensive and some good things to be said. I think that some of our gynecologists are recommending it now too.
I also wanted to ask you both, I'm not sure what is covered in sex education in schools today. The majority of our listeners are parents and grandparents. I remember when my daughter, she's now 45, I had to sign a paper for school. I think she was in 5th grade. At that time, her very best friend, who lived around the corner from us, was actually living with us for a few months while her parents were going through a divorce. They are still best friends, even though they live 2 hours away. That's never changed. My husband did not know I'd signed this paper. I didn't think I needed to tell him, but in retrospect, I wished I had. The 2 girls have come home from school and we're eating spaghetti that my husband has prepared for us. We're all sitting at the kitchen table and the girls are talking to one another as if we aren't there. My daughter said, gee, I heard a lot of stuff today in that sex ed class that I really didn't like. I don't think this is fair at all that a girl has to have a menstrual period every month. That's ridiculous. And her best friend said, well, I think boys have it worse. And my daughter looked at her and she said, why do you think that? And she said, because my brother has to sit on his nuts his entire life. And my husband's spaghetti flew out of his mouth and stuck to the wall. And they just looked at the spaghetti and continued their conversation. But I don't know how in depth does this go? I would assume that they're talking about menstruation and why it happens and when it happens and what to expect, etc. How far do they go? Do you know? Because I don't know.
There's a huge variant, first of all. I mean, some of the public schools, and they vary from state to state. There's an organization called SIECUS, or the Sex Information and Educational Council of the United States, that sort of tracks sex ed around the United States, to give us some idea of what's going on. Just taking the Baltimore area, the public schools, they basically start in 5th grade. They do it like every other year, I think, like 5th grade, 7th grade, something like that. They build on the curriculum all along. But for the most part, in public school education, and even Catholic school education, they do a lot more of what we've always called reproductive education and some of the taboos of sex. That's how we look at it. They don't really necessarily talk about sex or how to deal with sexual situations and things of that nature. If you get into the private schools, they can vary. I know that over the many years, Park School, for instance, has had quite a robust kind of sexual curriculum. Because some of our argument, I think, in my field is that parents have to sign often. So the parents who are reluctant to talk to their kids are the ones who aren't signing. And they're the kids that aren't getting sex education. So if you look at what we even recommend for sex education, it really should start real early, like age 4. Excellent books and materials that you can use to educate your children about sexuality. Why are we, holding back? And then when we get into the middle school years and the high school, we're not really talking to kids so much about what happened. Like, what happens if you're out on a date with a boy or a girl or whoever you're attracted to? You start kissing and you start, the drive increases and they ask you to, how do I handle this? What do I do? We don't talk about that kind of thing. Again, we do a lot of reproductive stuff, anatomy, reproduction, and then we talk about pregnancy and STIs, unless we don't. There still are abstinence-based programs that don't even address that.
Wow.
More and more, we're looking at not talking about LGBTQ stuff as well. In some ways, it just hasn't evolved very much since maybe years when my kids went to school.
Well, I think that's something that maybe our listening audience can pursue first in finding out what is going on in the school system. You mentioned that there are some good books on this. Do you by chance know any titles off the top of your head?
There's a series of books that have been around for a while. They're great. They're illustrated and they capture different age ranges.
Wonderful.
So it's the first one I think is called It's Not the Stork. So it talks a little bit about reproduction there.
I like that. It's not the story.
Yeah. There are a whole series of books that you can get, to kind of educate your kids, and they're designed for, each age. There are a few others out there, but I think that series is pretty good.
Are there other things that you want to educate us about today before I begin to close out our podcast?
Just mention real quickly something we didn't touch on. One thing to look at is there's a difference between desire and interest in sex, or we can make it different. When women think they're just going to have spontaneous sexual desire, that's a misnomer. And if they're waiting for that, they can often shut down around sexuality. So interest is different. And what I mean by this is you take a woman who's, say, 60 years old, 65 years old. I had a patient once, she was about 65. She'd been married for many years. She remembered having a very good sexual life with her husband, but after menopause, she really saw a decline in her desire. And what she said to me in my office was, look, I've lost my desire, damn it, and I want it back. That's desire. That's not interest. She had plenty of interest in being sexual. She wanted to, find a way to do that. But we have endless people who we can't figure out a reason why they might not have much in the way of wanting to be sexual. And when we boil it down, there's no medical reasons. There's nothing we can pinpoint. And yet they just don't seem to be interested in having sex with their partners. So that's a very different being. And we have to kind of be able to ferret these kinds of things out, because once again, desire is all over the place, based on individual people, based on where we are between menarche and menopause, but also all of these other things we've been talking about is all over the place. And then in long-term relationships, there's not a lot of spontaneous sexual desire. We just have to be real. But we can still help people to have good sexual lives. The object is to prioritize sex. And in couples who prioritize it, make it important in their lives, keep it going, we see 70s, 80s, 90s are still a sexual couple. They have to adjust, but they're still a sexual couple if they've always been a sexual couple and always felt it to be there. So these ideas of that it's all this physiology is kind of a misnomer. I mean, we have to look beyond that.
Oh, I like that. That's great information. Oh, my heavens.
I'd also like to point out some of the things that I talk to about women when I discuss their sexuality. In addition to what Kate talked about, I agree totally with all of the things that she said about sexual interest and changes and much of what we don't know about sexuality for women. I often point out to women that the media has lied to us about what sexuality looks like. Some of the questions that I want women to ask themselves, because this causes a lot of anguish, is where did we get our idea of what the correct amount of sexual desire is? Who says that the partner with the higher desire is the correct amount of desire? We each have the correct amount of desire for where we are in life. Women come to me and think they're very broken, and they're not broken. Their body is responding appropriately to whatever is going on. And I always ask, are you distressed by this because you're distressed by this, or are you distressed by this because your partner is distressed by this? And we really need to tease out what your motivations are, because if you're really distressed for your partner, that doesn't help you to regain your sexuality. Also, keeping in mind, as you're going through life changes, your partner is going through life changes too that alters their sexuality. One thing that a lot of women don't realize is that we actually have 2 FDA treatments now that can help some women with decreased interest. They're not for everybody. They're not magical cures, but there are a lot of options that we can talk about if women are feeling like this is something that they want to talk to their healthcare provider about. I appreciate that you have brought this topic out so that we can start the discussions. Thank you.
I want to thank both of you, Dr. Thomas and Dr. Sen, for joining me today and being very candid about intimacy and sexuality and where we are today with this. I still see it as a topic that unfortunately physicians avoid talking about. I find it rare they will ever bring it up. And if the patient brings it up, she's probably talking to a female doctor and not to a male doctor. That stigma still does certainly exist, unfortunately. And thank you, everyone, for joining us today for this very honest discussion about potential changes in a woman's libido through her lifetime. And again, I want to thank both of my specialists, our speakers, Dr. Thomas and Dr. Sen, for being part of the Johns Hopkins Medicine: A Woman's Journey Healthy Insights That Matter podcast series. To all of our listeners, I look forward to next month when we will feature another important women's health topic. Until then, take care of yourselves.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lily Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey acknowledges unrestricted educational support for our podcast, Healthy Insights That Matter from Astellas. For more information about A Woman's Journey's virtual programs occurring throughout the year and our monthly webcasts and podcasts, visit our website, hopkinsmedicine.org/awomansjourney. Like us on Facebook and Twitter, and visit our website at hopkinsmedicine.org/awomansjourney. Until next time, stay well.